Have you ever walked into a pharmacy and immediately felt at ease? Everything organized, clean, easy to find, professional, or walked into one that felt chaotic? Medicines everywhere, no privacy, nowhere to sit, staff running around confused? That difference is not a coincidence. It is the result of intentional design or lack of it. Pharmacy layout is one of the most practical and most examined topics in pharmacy training. It affects how safely medicines are dispensed, how comfortable patients feel, how efficiently staff work, and whether a pharmacy meets the legal standards of the Pharmacy Council of Ghana. In this episode, we are going to break it all down: the types of pharmacies, what the law requires, the key sections inside a pharmacy, how medicines should be arranged, and the rules that keeps everything running safely. Let's go. Types of pharmacies in Ghana. The Pharmacy Council of Ghana registers 6 types of pharmacies. Let us go through each one. Number one, retail pharmacy. This is the most common type you will encounter. It deals directly with the public, dispensing prescription and over the counter medicines. The minimum floor space is 36 square meters with a ceiling height of at least 3.2 meters. It must include a main customer area, a dispensary, an office, a counseling area, potable water, a sink, and a working surface for extemporaneous preparations. The recommended distance between a new retail pharmacy and an existing one is 400 meters radius. Number two, wholesale pharmacy. A wholesale pharmacy supplies medicines to other pharmacies and healthcare facilities, not directly to patients. It requires a minimum of 36 square meters and at least 4 rooms: a reception, a storeroom, an office, and a cashier or account room. The reception must have chairs for clients and a showcase displaying samples of medicines on sale. No external shelves are permitted beyond the reception. The signpost must clearly state "Wholesale only". Number three, retail and wholesale pharmacy. This combined type requires a minimum floor space of 48 square meters. It is not permitted in metropolitan areas. The wholesale and retail sections must be physically arranged so that they do not interfere with each other. Number four, manufacturing wholesale pharmacy. The proposed premises for this type must be at least 96 square meters. The finished product storage area must not interfere with the manufacturing activities or the wholesale business. Separate guidelines apply to this type. Number five, hospital and clinical pharmacy. This license is issued to established hospitals or clinics only. The pharmacy must be sited within the health facility and must be accessible to patients and clients at that facility. Number six, promotional and marketing offices. All promotional or marketing offices of local and international pharmaceutical companies must be registered in accordance with Section 93 of the Health Professional Regulatory Body Act 2013, Act 857. These offices must also be supervised by a registered pharmacist. General requirements for all pharmacy premises. Regardless of the type of pharmacy, The Pharmacy Council requires that every pharmacy structure meets the following and basic standards before a license is issued. The structure must be geographically and structurally permanent and accessible to all clients. A washroom must be provided within or adjoining the premises. Adequate ventilation and lighting must be provided throughout. Walls, shelves, and the counter must be well painted or polished with a washable floor. Appropriate storage facilities must be available for all pharmaceuticals and non-pharmaceutical products. A well-written signboard displaying the pharmacy's name must be installed. Toilet facilities are required. Relevant equipment and reference books such as standard treatment guidelines and a current pharmaceutical reference must be available and accessible. The name and registration number of the pharmacist on duty must be conspicuously displayed during business hours. These are legal requirements, not suggestions. Failure to meet or maintain them can result in sanctions, suspension, or closure of the pharmacy by Pharmacy Council. Sections inside a retail pharmacy. A retail community pharmacy is typically divided into three main sections and several important support areas. Let's go through each one. The main section. The main section is usually organized into three areas: the dispensary at the back, the over the counter area in the middle, and then public facing counter at the front where patients and customers interact with staff. This layer creates a natural flow. Patients come in, interact at the counter, staff retrieve medications from the dispensary, and the transaction is completed professionally. The Patient Counseling Unit (PCU). The Patient Counseling Unit or CPU is one of the most important areas in any pharmacy and it is a legal requirement. The PCU is a private or semi-private space where a patient can speak freely with a pharmacist or trained staff member about their medications, health condition, or any concern without interference from other customers. Think about it. A patient asking about family planning, HIV medication, or a mental health prescription deserves privacy and dignity. The PCU provides that. It can be a designated corner of the pharmacy or ideally a separate room. What matters is that it is available and actually used. Chairs must be provided in the counseling unit for both patient and the staff member. The store. The store is the central area where all medicines and related commodities are kept before they are moved to the dispensary or retail shelves. Managing the store properly is one of the most critical responsibilities in pharmacy practice. Here are the key rules. There must be a designated storekeeper or a person clearly in charge of the store at all times. The FIFO principle, first in, first out, must be strictly applied. Medicines that arrive first must be dispensed or sold first to prevent older stock from sitting behind newer stock and expiring. Similarly, the FEFO principle, first to expire, first out, means that regardless of when the medicine arrives, the one expiring soonest goes out first. Expiry dates must be monitored regularly. Expired medicines must be recorded in an expired drugs record book and physically removed from the active stock. Any breakages must be recorded. Any medicine added to or removed from the store must be documented. Regular stock taking is essential. It tells you how fast medicines are moving, identifies shortages before they become critical, and helps with accurate procurement. Medicine display rules. Now, here is something very important that every MCA, technician, and pharmacy staff must know: the rules around which medicines can be displayed and which cannot. According to the Pharmacy Council of Ghana, Class A medicines, which is prescription only medicines, must not be displayed to the sight of customers. Class B medicines, which is pharmacy only medicines, must also not be displayed to customers. Only Class C medicines, which is over the counter products and cosmetics, should be on open display where customers can see and access them. Why? Because displaying restricted medicines openly encourages self medications with dangerous drugs. This undermines the role of the prescriber and violates pharmacy regulations. This means your shelves behind the counter and in the dispensary is where Class A and Class B medicines are kept, should not be visible or accessible from the customer area. On a related note, MCAs should also be familiar with the different types of cosmetics available in the pharmacy, because customers will ask: some products are formulated for sensitive skin, some for dry skin, some for oily skin, and your knowledge helps you recommend the right one. Arrangement of medicines. How medicines are arranged in the pharmacy directly affects how quickly and accurately they are retrieved during dispensing. There are five main methods of arranging medications, and in practice, a combination of method is used. Method 1: by therapeutic activity. Medicines are grouped according to what they treat. For example, all analgesics are together in one area, all antacids in another, all anthelmintics in another. This is the most commonly used method in community pharmacies because it is logical and easy to work with. Method 2: by dosage forms or formulations. All tablets are grouped together, all syrups in one section, all topical creams in another, suppositories separately, and so on. This works well alongside the therapeutic grouping and is widely used for easy stock management. Method 3: alphabetical order. Medicines are arranged from A to Z: augmentin, benzoyl coartem, dalacin C, and so on. This is practical in dispensaries where staff know what they are looking for by name and needs to find it quickly. Method 4: by medicine class. Class A, Class B, and Class C medicines are kept in separate areas. This is essential for regulatory compliance. Restricted medicines must be inaccessible to the public. Method 5: by weight. Lighter medicines are placed on higher shelves, heavier medicines on lower shelves. This reduces the risk of injuries when retrieving heavy stock and prevents lighter packages from being crushed. In practice, the most effective pharmacies combine therapeutic grouping and formulation arrangement as their primary system because it supports both easy access and logical stock management. Hospital pharmacy layout. Hospital pharmacies operate differently from community pharmacies. Their design is driven by clinical care, not retail. Most hospital pharmacies under the Ghana Health Service follow a standard prototype layout. Whilst a specific minimum floor space is not defined in the same way as the retail pharmacies, most regional and district hospitals have dispensaries of more than 24 square meters. A typical hospital pharmacy includes a main dispensary, that is the primary area where medicines are prepared and dispensed to both inpatients and outpatients, a store for retrieving, managing, and distributing medications throughout the facility, a pharmacist office for administrative work, clinical documentation, and professional duties, a preparation room where extemporaneous preparations and a range of other medicines are compounded for direct dispensing to patients. The hospital pharmacy should be located where the staff and patients can easily access it, ideally on the ground floor of the facility with clear connections to the wards and outpatient department. Pharmacy layout is more than just where things are placed. It is a framework for safe, professional, and patient centered care. From the six types of pharmacies recognized by the Pharmacy Council to the required sections, the displayed rules, the storage management principles, and the medicine arrangement method, every element of pharmacy layout serves a purpose. When a pharmacy is well designed, patients feel safe, staff work efficiently, and the community is protected. This is the standard we uphold as pharmacy professionals. If this episode was helpful, please like, subscribe, and share with a fellow family. Drop a comment. Which method of the medicine arrangement do you use or see often in your pharmacy? Until the next episode, if God permits, bye bye for now.